Welcome back to Today's Health. In this segment, I'm speaking with cardiothoracic surgeon Dr. James Martin about expanded services available at McLaren Port Huron. Dr. Martin, I know that your experience as a cardiothoracic surgeon is extensive. Can you tell us a little bit more about yourself?
Well, I'd like to talk about my group. We have 4 surgeons. We are all very dedicated and highly trained professionals who work primarily in cardiac and thoracic surgery. Between the 4 of us, we have over 70 years of experience doing heart surgery, and I've been doing this for well over 20 years, including here in the Port Huron area since the mid-90s. We really are 4 people whose life focuses around heart surgery, and I think that is the thing that people need to know about us.
Now, what heart conditions do you and the other surgeons in your group provide treatment for?
So we care for all of the surgical diseases of the adult heart, with the exception of performing heart transplants. So we do bypass surgery, we do bypass surgery with heart-lung machines, we do bypass surgery without the heart-lung machine, what we call off-pump cardiac surgery. We do operations for valvular heart disease, both through a standard open approach as well as through minimally invasive approaches. We do aneurysm surgery for aneurysms of the thoracic aorta. We do heart rhythm operations for treatment of atrial fibrillation. And we also do general thoracic surgery for the treatment of cancers of the chest as well as benign disease of the chest cavity.
Now, doctor, as a cardiovascular surgeon, are you involved with the patient primarily just during surgery, or do you follow them throughout their course of treatment?
No, our group's policy is to provide very holistic care, so we pride ourselves on spending a lot of time with the patient before surgery, with the patient and their family, explaining what the benefits of an operation would be, what the alternatives to an operation would be, and why we think an operation is the best treatment for their disease. And then we do the operation, we meet with the family after the surgery to discuss exactly how things went, and then we are very involved in the post-operative care, both through the remainder of the patient's hospitalization and upon their discharge from the hospital until they've recovered from their heart operation.
Now, I would think that any type of heart treatment would lead to certain lifestyle and activity changes for the patient. What do you do to help them adjust after a procedure?
Well, we spend a lot of time with our patients discussing lifestyle adjustments, both in terms of dietary change, exercise, not smoking, following up with their physicians. And we have a very active program in cardiac rehab here at McLaren Port Huron that we encourage the patients to be involved with, which gives them a lot of educational material even beyond that.
Doctor, this has been great information today. What would you like for our viewers and family members to keep in mind if they have a heart condition and need treatment?
I think it's important that they understand that we are capable of providing the same care here in Port Huron at McLaren Port Huron that they would receive if they went to Detroit to get heart care.
Doctor, this has been great information. Thank you for joining us today.
Oh, you're most welcome. It's been my pleasure.
Stay with us. We'll be back after this break.